What's up? I'm Dr. K,
and Nurse Fatima.
and we are trying to bring you a nice broadcast that can both be hopefully educational and even possibly entertainment, whether on accident or on purpose. We'll try either way. We would like to have you with us and hopefully have a good time and learn something at the same time.
And keep it entertaining. We like educational stuff. We are both nerds. Maybe Dr. K is a little bit more of a nerd. I'm in a different kind of nerd and like to always educate, and spend our time. And any social media that you get from our side, we want it to be educational.
Honestly, the more information you have, the smarter it makes you as a person and the better decisions you get to make for yourself.
So we've decided that the first topic is going to be about something that not that many people feel comfortable talking about. It's getting a little bit better, but it's still not a very comfortable conversations to have. So, Dr. K, sexual health. What is the importance of sexual health and why we don't really speak about it?
All right. Well, first of all, it's been forever taboo. You just don't speak about it. But thankfully, in the last years, with the advent of Viagra and everything, everybody is now used to hearing about erectile dysfunction, ED, the blue pill, blah, blah, blah. But nobody really ever still talks about women's sexual health. And it's almost like it's been thrown to the side as if it doesn't matter almost. And quite frankly, it does matter because the studies show that people who have good active sexual lives are also the ones that tend to live longer.
And stay younger.
And stay younger as well. I mean, it's just having your hormones balanced out, having your libido up, and being able to have a performance in the bedroom as well, all lead to the good kind of hormones being released in your body, which help with everything else like cardiac stability, nerves. I mean, these are all things that are affected by your overall global health, and sexual health falls right in there.
Yes. So don't be shy to ask your when you have your annual checkup with your physician or at our office to ask if you have any kind of deficits in that part of your life, to ask what can you do about it? Is there something to be done? Now, what are some of the things that are done in our office when you come in or when you go to your primary care physician? What should be done? One, they are going to assess your blood work to make sure that your hormones and all your labs are in order.
That's one of the easiest things to check.
Yeah.
Is just check. I mean, just find out, are you deficient in your testosterone? And it's not just men. Women also have testosterone too, and it has a huge effect on libido and overall energy level and health as well. So that's one thing that needs to get checked. Obviously, if you're heading into menopause, there's a whole other series of hormones we need to consider as well. But that's a big one in itself. It's so easy to fix. Just check some blood work, and maybe that's what the problem is. And if that's fixable, let's fix it. If not, we move on.
We move on to the social deficits and like social things, such as maybe you need to see a therapist, maybe you need to work on some other things that needs to be worked on. Now, we're not therapists, but we can help you and guide you to get to those that are actually professional in that
identify
section.
simple things like, are there just major stressors that just prevent you from even being able to have time to have an intimate relationship? So there's a lot of things that come into play. It's multifactorial. It's not only physical, but it's mental health as well. So we try to put all these things together and hopefully stir the pot enough where we can wake things up and get you very active like things were in the past.
Now, we are super excited about our treatments that we have in the office, such as our acoustic wave therapy that you, Dr. K, you can name ours.
Sure. So we use the same kind of treatment for both men and women. For women, it's called La Femme Diva, and this is a non-invasive type of treatment where we actually use acoustic waves, similar to like the way machines are used for like treatment of kidney stones, but on a smaller level that's appropriate for sexual health organs. And what what these do is that they improve blood flow to the area, which then having improved blood flow then also means you have better nerve endings in that area, and better nerve endings means you feel things better in that area, and when you feel things better in that area, then you know, you know.
Now, how many treatments does it take to accomplish what we want to accomplish or improve what we want to improve?
As far as women's reproductive health or sexual health, if we're using the acoustic wave therapy, you're looking at about 6 sessions. It could even take 8 sessions, but that's generally where we start to see people having improvement. And then, once you start having some improvement, then you're going to need some maintenance, once or twice a year, something like that. But your initial treatment will take about 6 sessions, maybe 8 sessions.
And they're twice a week in a row, right?
Yeah, so you come 2 times a week for 3 to 4 weeks in a row. And then that's what helps to regenerate those blood vessels in there.
What about the gentlemen's?
So for the men, we also have the same kind of treatment where we're using an acoustic wave therapy, where in men we know very well that part of the reason that men can have an erectile dysfunction is if there's issues with the blood vessels being clogged up with plaque, similar to like how people end up having a heart attack where their blood vessels get clogged with cholesterol, deposits. And so by using this energy from the acoustic waves, you actually break apart those particles of plaque that are blocking those vessels, and you allow them to reopen, for one thing, and then you also get to produce new blood vessels as well. It's angiogenic, we call that. So you produce new blood vessels, and once again, if you have better ability to provide better flow to the penis, you're going to be able to have better, stronger, and longer erections, and that also can be helpful to leading to the final point as well. So
now the name of our treatment, the name of this procedure.
Yeah, I forgot. You didn't pick up on that, so you just keep going.
It's called the fellas treatment. But anyhow, for the fellas too, for the guys, it is also twice a week.
So for the fellas men's revitalization is what we call our acoustic wave therapy for men's treatment, and this is going to be a similar type of treatment. You're looking at about 6 to 8 sessions again. Probably for men it's a little bit more, usually more closer to 8 sessions, and you're coming twice a week for about 3 to 4 weeks in a row. And that's when people start to see the breakup of the plaque, and you start to get improvement of the blood flow, as we were talking about. So, and then from there, if you're having good results, fantastic. You just need to make sure you stay on schedule to have some maintenance, so that you don't fall behind again. So, we have a few different things that we are going to be doing. You're going to need to get interviewed, so you have a proper understanding of what's going on. Second of all, you're going to need to have your hormone profiles checked, and then of course, if there's any kind of a physical dysfunction, then we'll be working on figuring out how to improve that dysfunction as well.
What are the other treatments that are some of the other treatments that are available are PRP injections, the acoustic, also Mona Lisa for the ladies, along with the acoustic wave. And we are going to have to end this talk, and our next conversations is going to be about menopause. And if you have any topics that you want us to talk about or explain, let us know in the comments and we will get to it.
All right, see you guys soon.
Ciao.